Hello everyone, this is Lamp AcuWellness Foundation with hand acupuncture. Today we feature introduction, hand anatomy, and hand acupuncture point therapy. Hand therapy uses specific points or areas on the hand in the treatment of diseases of the whole body. Acupuncture, massage, acupressure, moxibustion, and external medical applications are commonly used in this therapy. Hand acupuncture focuses on stimulating points based on the theory of meridians and the relationships with Zang Fu, qi and blood, to increase energy flow and balance internal organs. This therapy is unique in its ability to treat pain, especially acute muscular strain. Hand acupuncture therapy has been very well developed over the last 40 years and includes several systems. Since ancient times, people have used the shape, color, and palm crease lines of the hand to analyze and diagnose disease. People also used herbs, acupuncture, and massage techniques to treat whole body or local diseases. The Book of Neijing describes in detail the information known about the hand meridians and points. Hand acupuncture therapy was developed into a formal system in the 1970s. Medical practitioners from all over the world developed the system based on the idea of inserting needles on the hand points to treat another part of the body. Based on the theory of meridians and clinical experience, practitioners found many new points on the hand to develop the hand acupuncture system. Dr. Yun Peng Feng of Xi'an, China, invented hand imaging acupuncture. He discovered that there are three small ratios of the human body vertically distributed on the hand. These three human body figures are distributed separately but overlap on the hand. Dr. Shin Ming Wang studied and researched the patterns distributed on the hand as well as the relationship between the hand points and the meridians. He also published a chart of the hand. Dr. Tai Wu of Korea invented choreo hand therapy in 1971. He put the complete 14 meridian system on the human hand to develop a hand micromeridian system. Many Chinese health practitioners not only studied the standard hand acupuncture system, but also summarized and developed many different types of hand acupuncture. Hand acupuncture therapy, like other microsystems, is new and was developed in the 1970s based on traditional Chinese medicine meridian theory. There is a relationship between the hand and internal organs through the meridian connections. Through modern medical science, it has been recognized that the hand has an abundance of nerves and is able to feel the shape, size, temperature, and weight of an object. The pattern of the palm crease lines can also give information about the disease. According to bioholographic theory, the whole hand and the second fifth metacarpal bone contain all of the information of the whole human body. When the human body has a disease, the information of the illness will be reflected on the hand. Stimulation on the hand will open the network of meridians to enhance immune system function, to prevent and treat disease. Hand therapy is easy to use and has a wide range of clinical applications. The results are well established and there are no side effects. Now let's talk a little bit about hand anatomy. The hand is a sensory organ as well as a manipulative tool. The hand consists of three parts: the wrist bones, metacarpal bones, and phalangeal bones. The joints connecting them form the anatomic foundation of the hand. The hand has four sides termed palmar, dorsal, ulnar, and radial. At the center of each palm there are three creases: the radial longitudinal crease, proximal transverse crease, and distal transverse crease. On each side of the palm are the muscles of the thenar and hypothenar eminences. There are 5 fingers on each hand: thumb, index finger, middle finger, ring finger, and little finger. The skeleton of the hand consists of the carpus, the metacarpus, and the phalanges. The 8 carpal bones run in 2 rows of 4. Scaphoid, lunate, triquetrum, and pisiform make up the proximal row running from the radial to ulnar side. Trapezium, trapezoid, capitate, and hamate make up the distal row running from the radial to ulnar side. There are 5 metacarpal bones numbered in radial to ulnar order. The metacarpal bones are miniature long bones with a distal head, a shaft, and an expanded base. The first metacarpal bone is the thumb. The second metacarpal bone is the index finger. The third metacarpal bone is the middle finger. The fourth metacarpal bone is the ring finger. And the fifth metacarpal bone is the little finger. There are a total of 14 phalanges, with 3 in each finger and 2 in the thumb. The 3 phalanges are the proximal, middle, and distal phalanges. Between each phalanx are metacarpophalangeal joints, proximal interphalangeal joints, and distal interphalangeal joints. Soft tissue. The skin over the dorsum of the hand is thin and mobile, which allows for flexion at the metacarpophalangeal and interphalangeal joints. The palmar skin is thick and hairless and has dense nerve endings and sweat glands, but no sebaceous glands. The superficial fascia on the dorsum of the hand is thin and loose, which allows the skin to be easily moved. Lobulated pads of fat subdivided by fibrous septa are located on the palmar aspect of the hand. Cutaneous nerves, blood vessels, and superficial lymphatics run on the superficial fascia. The deep fascia forms retaining bands for the tendons around the wrist area. On the palm of the hand, it develops the thenar and hypothenar eminences. Between them is a triangular sheet-like tendon. It also blends with the superficial fascia in the digits. The fascia of the hand lubricates structures in transit between the forearm and digits, transmits loads, protects underlying vessels, and provides a framework for muscle attachments. The muscles of the hand are confined to the palm, but their tendons proceed to the digits. They are the interosseous muscle, the thenar eminence, the hypothenar eminence, and the lumbrical muscles. Blood is delivered to the hand by the radial and ulnar arteries. The superficial and deep palmar arches connect these 2 vessels in the palm of the hand, and further branches go to the proper palmar digital arteries and palmar metacarpal arteries to the finger webs. The superficial veins of the hand include dorsal and palmar digital veins and the cephalic vein. The deep veins of the hand include the superior and deep palmar venous arches and the palmar and dorsal metacarpal veins. When the hand has a severe injury or laceration, bleeding is profuse and usually cannot be controlled by compression of only one major vessel due to the multiple anastomosis between all the vessels of the hand. Superficial injuries to the dorsal side of the hand will result in more bleeding. If an injury is on the fingers, it is more effective to stop bleeding by pressing on the ulnar and radial side of the fingers due to the vessel's location. Nerves and lymphatic vessels. 3 nerves provide the majority of innervation of the hand: the median nerve, ulnar nerve, and radial nerve. They provide motor and sensory function to the hand. Lymphatic vessels form a rich subcutaneous plexus in the hand. The lymphatics drain the radial side of the hand and terminate in the axilla. The ulnar side of the hand is in the supratrochlear nodes around the elbow. This figure illustrates the anatomy of the hand. The 5 fingers of the hand are the thumb, index finger, middle finger, ring finger, and the little finger. There are 4 hand crease lines: transverse crease of the wrist, distal transverse crease, the proximal transverse crease, and the radial longitudinal crease. The 4 sides of the hand are the palmar side, dorsal side, the ulnar side, and the radial side. The 3 phalanges, the distal, middle, and proximal phalanges. The 3 joints, metacarpophalangeal joint, the first interphalangeal joint, proximal interphalangeal joint, and the second interphalangeal joint or distal interphalangeal joint. The 8 carpal bones. On the proximal row, we have scaphoid, lunate, triquetrum, pisiform. On the distal row, trapezium, trapezoid, capitate, and hamate. And finally, we have the 5 hand metacarpal bones. First metacarpal bone is the thumb, second metacarpal bone, index finger, third metacarpal bone, the middle finger, fourth metacarpal bone, ring finger, and the fifth metacarpal bone, little finger. We shall be discussing the hand acupuncture systems, which include hand acupuncture point therapy, the new hand acupuncture therapy, the choreo hand acupuncture therapy, hand imaging acupuncture, and hand meridians and points therapy. For this episode, we shall be discussing hand acupuncture point therapy. Hand acupuncture point therapy was developed in the 1960s based on the theory of the meridian system and the relationship of the hand with the Zang Fu Qi blood yin and yang. According to the root and branch theory, the hand is the root where the meridian energy starts and is distributed. Based on bioholographic theory, it is recognized that each cell of the biologic body contains all the information of the entire organism. Any independent part of the body contains the information of the whole body. The hand is an independent part of the body. There are many reflex points that contain information of the human body and organs. Stimulating the reflex points can treat a specific area or associated organ disease. The meridian theory and bioholographic theory have provided information for the hand acupuncture system. Since the 1960s, after many years of clinical research and practice, hand acupuncture has been gradually improving. The most remarkable aspect of hand acupuncture is its good results for pain control and acute injury. Point locations and indications. Let's start with the dorsal aspect of the hand. The eye. Location at the border of the light and dark skin on the ulnar side of the thumb at the interphalangeal joint. Indications: multiple eye disorders such as redness, pain, blurred vision, and night blindness. The shoulder. Location at the border of the light and dark skin on the radial side of the index finger at the metacarpophalangeal joint. Indications: shoulder disorders such as pain and periarthritis. The forehead, gastrointestinal disorders and appendicitis. Location at the border of the light and dark skin on the radial side of the index finger at the proximal interphalangeal joint. Indications: frontal headaches, stomach pain, vomiting, abdominal pain, diarrhea, knee pain, and toothache. The vertex. Location at the border of the light and dark skin on the radial side of the middle finger at the proximal interphalangeal joint. Indications: pain at the vertex, neurological headache, and dysmenorrhea. Side of the head. Located at the border of the light and dark skin on the ulnar side of the ring finger at the proximal interphalangeal joint. Indications: migraine headache and intercostal nerve pain. Perineum. Location at the border of the light and dark skin on the radial side of the little finger at the proximal interphalangeal joint. Indications: dysmenorrhea, leukorrhea, and pain of the perineum. Occiput, or the tonsil. Location at the border of the light and dark skin on the ulnar side of the little finger at the proximal interphalangeal joint. Indications: occipital pain, tonsillitis, sore throat, stiff neck, back and arm and mandibular pain. The vertebrae. Location at the border of the light and dark skin on the ulnar side of the little finger at the metacarpophalangeal joint. Indications: back pain, acute low back sprain, herniated disc, tinnitus, and nasal congestion. Sciatic. Location between the ring and little fingers at the ulnar margin of the metacarpophalangeal joint of the ring finger. Indications: pain in the low back, leg, hip, and buttocks. The throat. Location between the middle and ring fingers at the ulnar margin of the metacarpophalangeal joint of the middle finger. Indications: sore throat, toothache, and trigeminal neuralgia. The neck. Located between the index and middle fingers at the ulnar margin of the metacarpophalangeal joint of the index finger. Indications: wry neck, swollen, stiff, or sprained neck. Then we have the lumbar and leg. Location: 2 points, located 1.5 centimeter anterior to the transverse crease of the dorsum of the wrist. Lumbar and leg 1 is located on the radial side of the tendon of the second extensor digitorum manus between the index and middle fingers. Lumbar and leg 2 is located on the ulnar side of the tendon of the fourth extensor digitorum manus between the ring and little fingers. Indications: acute low back and leg pain. Lumbar and leg 1 treats injury above the low back, chest, scapular, and upper arm. Lumbar and leg 2 treats injury on the low back and sacrum areas. Raise blood pressure point. Location at the midpoint of the transverse crease of the dorsum of the wrist. Indication: low blood pressure due to any cause. Hiccup. Location on the distal interphalangeal joint of the middle finger at the midway point of the transverse crease. Indication: hiccups. The reduced fever point is located on the radial side of the middle finger, 0.1 sun posterior to the corner of the nail. Indications: reduced fever and stop diarrhea. The diarrhea point is located 1 centimeter proximal to the midpoint of the line between the third and fourth metacarpophalangeal joints. Indication: diarrhea. The stop itching point. Location at the border of the light and dark skin on the ulnar side of the hand, 1 centimeter distal to the transverse crease of the wrist. Indication: itching of the skin. Now let's go to the palm of the hand. We have the ankle point. Location at the border of the light and dark skin on the radial side of the thumb at the metacarpophalangeal joint. Indication: sprained ankle and pain of the ankle joint. The chest point, located at the border of the light and dark skin on the radial side of the thumb at the interphalangeal joint. Indications: chest pain, vomiting, diarrhea, and seizures. The gastrointestinal point. Location midway between pericardium 8, Lao Kung, and pericardium 7, Ta Ling. Indications: chronic gastritis, stomach ulcers, indigestion, and biliary ascariasis. The heel pain point. Location midway between pericardium 7, Ta Ling, and the gastrointestinal point of the hand. Indications: heel and foot pain. The stop convulsions point. Location at the midpoint of the intersection of the thenar and the hypothenar eminence. Indications: convulsions and high fevers. The malaria point. Location at the articulation of the first metacarpal bone with the wrist on the radial margin of the thenar eminence. Indication: fever due to malaria. The tonsil point, lung 10. Location at the midpoint of the first metacarpal bone on the radial side at the junction of the light and dark skin. Indications: tonsillitis and sore throat. The cough and wheeze point. Location: between the second and third metacarpophalangeal joint on the palmar side. Indications: bronchitis, asthma, and headache. The toothache point. Location: between the third and fourth metacarpophalangeal joint on the palmar side. Indication: toothache. The new asthma point. Location: between the fourth and fifth metacarpophalangeal joint on the palmar side. Indication: asthma. Spleen point. Location: at the midpoint of the transverse crease of the interphalangeal joint of the thumb. Indications: disharmony of the spleen and stomach, diarrhea, and abdominal pain. The small intestine point. Location: at the midpoint of the transverse crease of the proximal interphalangeal joint of the index finger. Indications: indigestion and abdominal pain. The large intestine point. Located at the midpoint of the transverse crease of the distal interphalangeal joint of the index finger. Indications: diarrhea and constipation. Sanjiao point. Location: at the midpoint of the transverse crease of the proximal interphalangeal joint of the middle finger. Indications: chest, abdominal, and pelvic cavity diseases. The heart point. Location: at the midpoint of the transverse crease of the distal interphalangeal joint of the middle finger. Indications: palpitations and chest pain. The revive point. Location: at the tip of the middle finger, about 0.2 fen from the fingernail. Indications: coma and heat stroke. The liver point. Located at the midpoint of the transverse crease of the proximal interphalangeal joint of the ring finger. Indications: hypochondriac pain and fullness of the abdomen and stomach. The lung point is located at the midpoint of the transverse crease of the distal interphalangeal joint of the ring finger. Indications: cough, asthma, fullness of the chest, and chest pain. Mingmen. Location: at the midpoint of the transverse crease of the proximal interphalangeal joint of the little finger. Indications: low back pain, nocturnal emissions, and impotence. And finally, the kidney point, located at the midpoint of the transverse crease of the distal interphalangeal joint of the little finger. Indications: nocturia, bedwetting, and urinary tract infections. Thank you very much for your attention, and see you in our next videos.